Hi everybody, John here in Spokane, Washington, and if you've been following my blogs, you know that I've been under the weather. I feel a whole lot better right now than I have in the past 10 days probably. I am drinking not a beer, I'm drinking a kombucha. And my voice still gets raspy, but I've had coughing fits that are very intermittent now. Jackson says hi, just woke him up, so we'll have to deal with that. So I want to talk about respiratory hygiene and what you can do. First off, stop smoking, and that's all I'm going to say about that. But number two, when patients come in and they have operations, their lungs aren't expanding, and you wake up and we ask you to blow on this, now Richter, don't go there, blow on this thing that helps your lungs to expand. And so I've been following the news. If you know me, I'm a newsaholic. About the signs and symptoms, how they develop, what patients are telling us, and I'm getting this from TV. This has nothing to do with my hospital. I'm not a doctor. You know, I'm just trying to help people, and so that's it. I don't represent anybody. I'm all on my own. What you need to do for respiratory hygiene. This bug starts out as a tickle in your throat, and then it seems to migrate down to the upper airway where it likes to hang out. And at some point during this 14-day incubation period, it drops down to your lungs. And that's when the bad stuff sets in. So there's a YouTube video that I'm going to post after this that came out of Italy today, I believe. And this doctor, they're working in the ER like an ICU. So things might happen like that here, hopefully not, but I'm going to show you what you can do at home. So you got that tickle in your throat, you listen to my video, what are you going to do? You're going to start with deep breathing. Start with the abdomen, upper chest, into your sinuses, and blow out. Also, neti pots are great. If you know me, I've done all kinds of sinus surgeries and what have you, and I have got a neti pot. I don't represent any brand or anything. Whatever you can make, I should have invested in this company because I bought these products so much and they've helped me with my sinuses. But you're basically using distilled water, or try not to do water out the tap. You would boil some water, let it sit overnight, and cool off, and you could use that water if you wanted to. You're going to go over sink and you're going to put this up your nose and let it go out one side, and I would do that a few times a day. Wash those sinuses out. That's where those bugs like to stay. The other thing that I posted a video and it got taken off of Facebook, but I've come up with my own idea that I think my grandma, she used to do this when she was sick. She would put the tea kettle on and she would stand over it with a towel and let that mist get in there. And so the video that, it's a doctor, this is not my idea, but I kind of built onto it. Just sit here, let this hot steam go into your nose, breathe out. You want to do that. You don't want to burn yourself, right? Hopefully you're an able-bodied adult that's not drinking, and you know, if you're not, then find a friend. You're going to breathe this in, and you're going to want to cough that out, because as you're going to have that dry cough, you're going to want to cough. It's going to hurt to cough. I made myself cough to get that stuff out, or I think I would have been in the ICU. You're going to have to fight this if you get it. So dry tickle in the back of the throat, and then you're going to want to sit with that steam pot like that for 5 minutes, 5 times a day is what the guy recommended, Dr. Limke, I think. Cough, deep breath, get that stuff out, and then go do a neti pot like this. And the stuff that's going to come out is, you're going to be amazed. So I feel a whole lot better. Tomorrow is day 14. I have started retracing my steps, and it's going to come out anyway. The last day I worked at the hospital was Friday, March 6th. And tomorrow is day 14. I got sick that Tuesday night after March 6th and went to urgent care, and that's when I got diagnosed with the bronchitis. So try that. If you have any questions, respiratory therapists, they can explain this a whole lot better. Sorry, I've got cold medicine inside too, and that's keeping me probably a little excited. Plus, I want to make sure everybody knows about this. And don't burn yourself. Use common sense, please. If you have any questions, if I can explain again, keep those sinuses, especially if you get sick, keep those sinuses clean, expand those lungs, stop smoking, and force yourself to cough, because the bug wants to win and make you not cough, but you have to do it. What you saw this morning when I was doing that, it hurt. It hurt just to do that. That was the most I could do, but you've got to force it, and you've got to get that stuff out of there, all right? Peace out. Live long and prosper.